Okay. So now you've seen the way a lot of different kinds of liver congestion could impact your ability to lose weight. But you may be thinking, well, my doctor said all my liver labs were within normal limits, so I don't think that that's what's going on with me. But there's a couple of things to think about here. One is the reference ranges themselves really may not be accurate. And then so that you're, being told it's within normal limits, but it's really not at a healthy level. And then the other thing is the interpretation of what a positive or a negative result on a lab is actually telling you, which is the difference between a rule in and a rule out. So a great and apt example of that is non-alcoholic fatty liver disease, which is very common. And this is a really good example where these kind of things come in play. So non-alcoholic fatty liver disease means there's too much triglyceride in your liver. And I really wish they would just call it triggy liver or triglyceride liver, because I hate just saying fatty, fatty, fatty to my patients because I feel like I'm calling them a fatty. And also it's misleading because you can absolutely be very slender and have too much fat in your liver. And that's a good example of a rule in, rule out. I'm thin, so I don't have fatty liver. And it's just like, no, if you're very heavy, probably you do. But if you're very thin, nope, that's not a rule out. And to drive this point home a little bit more, when people are doing or want to donate a portion of their liver to another person, they have to absolutely rule out that they don't have fatty liver because the transplant won't work well. And the only way to absolutely rule out fatty liver is with a liver biopsy. So they are going to do that on every single donor in a program like that. But they're not even going to go that far and do something as invasive and painful of a biopsy if there's a pretty good chance they have fatty liver. So they will first, if they have to be a normal weight. They cannot be diabetic or pre-diabetic. All those liver labs have to be within normal range. They will do an ultrasound, actually look at the liver with an ultrasound, and all those things come back, and then none of them are kind of indicating that fatty liver may be there. But that doesn't mean that it's not there. Those things would be rule ins if they were positive, but they're not really rule outs. So they will then do a liver biopsy, and they've done a study where they take this group of people, which by the way is not really representative of the average American, myself included, meaning that their weight is healthy, all their sugar levels are healthy, their liver's within normal limits, the ultrasound is negative, and then they do the biopsy, and 40% of those people will turn out to have too much triglyceride in their liver. So this is really very prevalent. And I want to talk about some of the specific apps that could rule in, and particularly where the normal reference range, like all of these would be numbers that are within the normal reference range that most of your doctors will show you on your lab reports, but they still are highly correlated with a higher likelihood or higher risk of fatty liver. And in fact, there is a great calculator that you can use called the Fatty Liver Index, where you will plug in one of your labs, GGT, and your triglyceride level, your waist circumference, and your height. And it will calculate for you with a really high level of accuracy whether or not you have fatty liver and how severe it might be, and what kind of workup you would need to go forward. And I recommend it, and I'm going to link it below this video. Now, some of those labs, when you go to your doctor, you'll get something often called a Chem Panel, which should include a fasting glucose. So always fast before you go for a Chem Panel, a fasting glucose, and then within normal limits will be anything below 100, meaning above 100 and you're pre-diabetic. But above 90, you have a pretty good likelihood that there is something going on and that maybe you have fatty liver. The AST, now this is specifically a liver enzyme. And in women, anything over an 18 is problematic. And for men, anything over 30. And both of those will be often within the normal range on the lab values. But hepatologists, that's doctors that specialize in liver medicine and liver research, they will say for women, anything over an 18 needs to be explained. Now, it could be that you had some food poisoning or a big virus, or that you have maybe too much iron in your blood. It could be some other things. This is not very specific. It's more of a sensitive issue. But because the too much triglyceride in your liver is so common, that's generally going to be what's going on. Then GGT, now that's not going to be part of a Chem Panel, but that one's even more correlated with fatty liver more specifically than the AST. And so you can get that as an add-on. It's not terribly expensive. Your fasting blood glucose, we talked about. Morning insulin, if you're getting that raised, anything over a 10 would be a problem. And then, high triglycerides, certainly. And I think those are all the ones I wanted to point out. So I'm going to list those in a little cheat sheet below. You don't have to rewind this video and watch that again. But it's just one good example of where you can't kind of overinterpret your labs and that they may not be sensitive enough or specific enough to really tell you what's going on. And it certainly couldn't hurt you to make your liver healthier no matter the cost. Thanks.